name is Jana Goldcamp, and I'm an FNP student at Maryville University. Today I have Cindy here, and I'm going to be performing and examining to check for her cardiac system and respiratory system. I'm going to begin by inspecting for any jugular venous distension. Make sure there's none noted there. I'm going to look at her neck, and I'm going to visualize and palpate the trachea, making sure it's midline and that there's no masses noted. I am also gonna listen to and auscultate her carotid arteries. So first I'm gonna palpate her carotid pulses. You just do this one at a time on the right and the left. And then I'm gonna do the same thing by using the bell of my stethoscope, having the patient hold their breath. And I am also gonna do this one at a time by checking the carotid pulses. Okay, note for intensity and amplitude. Make sure that it's not, normal would be like a 2+. We're next going to move on to inspecting the patient's back. So I'm going to ask the patient to turn around. I'm going to look at Cindy's back here and just assess for her respiratory rate, which should be, it looks like it's about respiratory. It's about 18. And kind of look at the rhythm. The symmetrical rise and fall. It should be unlabored, so when she breathes in, it should be nice and symmetrical. I'm going to inspect and palpate and percuss the costovertebral angle and make sure that there's no pain. So what I'm going to do is just percuss here. Make sure there's no pain there. I'm going to check for thoracic configuration by noting the anterior-posterior diameter, which should be less than 1. I'm going to check for expansion by placing my hands at the patient's 10th ribs and ask the patient to take a nice deep breath and make sure that it's symmetrical and there's a nice symmetrical rise and fall. I'm going to then go on to palpating for tactile fremitus, and that is when I use my palms. I'm going to ask the patient to say 99.
99, 99, 99, 99.
Now I use my lateral sides of my hands to do the same thing.
99, 99, 99, 99.
I'm going to do this at her sides as well.
99, 99, 99.
Okay. I am then going to percuss systematically between her intercostal spaces, and we should be hearing resonance. Systematically moving down. Okay. I'm then going to check for a diaphragmatic excursion by asking the patient to lean forward and crossing her arms. And Cindy, if you could just hold your breath, and I'm going to mark with a pen the area where the sound changes. Okay, mark here, and have her release that breath. And take another deep breath in, and mark again where the sound changes. And the normal findings should be 3 to 5 centimeters. I am then going to auscultate systematically with using the diaphragm of my stethoscope, and I'm basically just moving laterally and just to listen to for any editous sounds. So I want to make sure there's no crackles, that there's no wheezing, and that the lungs just sound nice and clear, which they do. Okay. I'm going to have the patient turn around, and I'm going to continue to listen and auscultate her lungs. Again, moving just as I was before, systematically. And same thing, checking for crackles or wheezes. I'm also going to do that on her lateral sides, listening to the lungs there. Okay. I'm going to have I'm going to look at then I'm going to just check the chest wall. I want to look for a good color, no cyanosis noted, that her rise and fall of her breaths is nice and symmetrical, that there's no nasal flaring, that she's not using any accessory muscles to breathe. I'm then going to go on and check the pericardium. I'm going to first inspect for any, that there's no heaves or lifts. I'm going to then palpate, checking for the same thing, for there's no thrills, heaves, or lifts noted. So I just look at the apex of the heart, the left sternal border, the base, and the apical pulse. and I allow the cardiac movement to move to my hands, and no thrills, heaves, or lifts. I'm going to palpate the chest wall for any tenderness or masses. And then I'm going to repeat tactile fragmentus again, saying 99.
99, 99, 99,
And
99,
my lateral sides of my
99,
hands.
99,
And at the sides.
99, 99.
Okay. I am going to then percuss in the patient's anterior intercostal spaces, and we should hear resonance here as well. Okay. I'm then going to go on to listen to the heart. So we're going to auscultate the heart sounds by at different points. First, we're going to check at the aortic point of the heart, the pulmonic, Erb's point, the tricuspid, and the mitral. We're going to repeat that with the bell of our stethoscope because we just did it with the diaphragm. We want to make sure that we can hear S1 and S2 sounds, noting for any S3 or S4 sounds. S4 would be like an abnormality, any murmurs, any gallops, or thrills. And then I'm going to ask Cindy to lay on her left side, and I'm going to listen to her heart with both my diaphragm of the stethoscope and the bell of my stethoscope, as well at those points of the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and that completes our cardiac and respiratory exam. Thank you very much.